Section 3. Waivers for people with developmental disabilities. In this section, you will learn about the variety of supports and services that are available through waivers and how people become eligible for waiver supports and services. The assessment, planning, implementing, and documenting activities are also discussed. Waivers for people with developmental disabilities. The 3 Virginia Medicaid waivers that support people with developmental disabilities, DD, provide a way to pay for certain long-term supports and services in communities with a mix of state and federal funding. Federal funding comes from the Centers for Medicare and Medicaid Services, CMS, and waives specific federal Medicaid requirements. Waivers have provided funding to allow many individuals who would have required institutional services to receive a variety of needed services and supports in the community. Virginia's waivers are built on the idea of individualized supports. Services are developed and funded based on a person-centered approach as discussed in Section 1. Each person, with assistance if needed, chooses different types and levels of supports based on his or her desired goals, outcomes, choices, and needs. Most services are agency-directed services, in which the provider agency hires staff to work with the person. Some are consumer-directed services, also known as self-directed, in which the person, or his or her family, employs the staff person. People can also use a combination of both agency-directed and consumer-directed services. Virginia recently redesigned the waivers for people with DD, and there is now one process to qualify for and access supports and services. The redesigned waivers provide more targeted, flexible, needs-based services. Create more choices and opportunities. Promote consistency, equity, quality, and accountability across the waivers, and increase flexibility in service design. As presented in Section 1, 3 waivers support people with DD. The Community Living Waiver is a comprehensive waiver that includes 24/7 residential services for those who require that level of support. It includes services and supports for adults and children, including those with intense medical and/or behavioral needs. The Family and Individual Supports Waiver supports people who live with their families, friends, or in their own homes. It provides support to people with some medical or behavioral needs and is available to both children and adults. The Building Independence Waiver supports adults 18 and older who are able to live in the community with minimal supports. This waiver does not include 24/7 residential services. People using this waiver own, lease, or control their own living arrangements. Waiver services. Waiver services are divided into the following categories: employment and alternate day options, self-directed and agency-directed options, residential options, crisis support options, medical and behavioral support options, additional options. Each of the options contain multiple services which are available in one or more of the DD waivers. Information about these services is available from your supervisor. It is important that you know about the variety of supports that are available so that you can assist in planning for each person you support. You can refer to this document or other agency documents as needed to become familiar with the array of service options rather than trying to remember all of them. Employment and day services. Individual Supported Employment Group, Supported Employment, Workplace Assistance Services, Community Engagement, Community Coaching, Group Day Services, Residential Options, Independent Living Supports, Shared Living, Supported Living, In-Home Support Services, Sponsored Residential, Group Home Residential, Self-directed and agency-directed options. Consumer-directed services facilitation. Personal assistance services. Respite. Companion. Crisis support options. Community-based crisis supports. Center-based crisis supports. Crisis support services. Medical and behavioral options. Skilled nursing. Private duty nursing. Therapeutic consultation. Personal emergency response system. Additional options. Assistive technology. Individual and family or caregiver training. Electronic home-based services. Environmental modifications. Using waiver supports and services. Eligibility for waiver services. In order to be eligible for services funded through waivers, a person must meet the following criteria. Have a diagnosis of developmental disability. Meet Medicaid financial eligibility. Meet the level of care criteria as determined by the Virginia Individual DD Eligibility Survey (VDES) and accept services within 30 days. The criteria for waiver eligibility include diagnostic, financial, and functional. Eligibility determination and slot assignment. In order to use services through the waivers, a person needs to be determined eligible for services and assigned a slot. There are a limited number of slots, and everyone who is eligible does not get to receive services right away. If a slot is not available, the SC determines the individual's priority needs level and places the person's name on the waiting list via Virginia Waiver Management System, WAMS. A critical needs summary documenting the person's level of urgency is also completed by the SC. When a slot becomes available, the DBHDS supported regional committee will assign the slot to the person on the waiting list who is found to have the greatest need for services. The DDS Electronic Service Authorization System is called WAMS, Waiver Management System. Determination of support. When someone is determined eligible and a slot is available, the level of support needed is assessed. A tool that is used to determine individual support levels is the Supports Intensity Scale, SIS. The SIS measures support needs in the areas of home living, community living, lifelong learning, employment, health and safety, social activities, and protection and advocacy. It is administered by qualified, trained interviewers. Support coordination. Each person who is enrolled in a waiver is assigned a support coordinator, SC. SC work for or contract with the CSB that serves the area in which the person lives. The SC is responsible for linking the person with service providers, as well as coordinating and monitoring the services. The SC, waiver service providers, the person's family members and others he or she chooses, meet together to help him, her develop an individual support plan, ISP. Choice. Eligible individuals for whom a slot is available must be allowed to choose whether they want to participate in the waiver program, what services they will receive, who the service providers will be, what's in their plan, and the supports to be provided. Considerations in community settings. The Home and Community-Based Services (HCBS) settings regulations became effective in March 2014. The regulations are designed to enhance the quality of HCBS, provide additional protections, and ensure full access to the benefits of community living. They establish requirements for the qualities of settings where individuals live and or receive Medicaid reimbursable HCBS services. The rules focus on the quality of individuals' experiences so that people receiving Medicaid-funded HCBS have services that protect individual choice and promote community integration. Click on the next link to continue the training part 2.